So good afternoon, everyone. I hope you can all hear me loud and clear.
Good morning. Sorry, good afternoon. I can hear you.
Thank you, Steve. I welcome you all to today's session, and I would like to start this session with a word of prayer. Let's pray. Our dear Heavenly Father, we thank you and we honor you. Father, thank you even for this time that we are starting our webinar sessions, and we pray for your guidance. May you start with us and may you end with us. May you be with all the attendees and may you also be with all the panelists. Help us to have a very wonderful discussion. In Jesus' name we pray, amen. All right. So I welcome you all to today's webinar session, the start of a series of webinars. So the Kabarak University Center of Health Informatics, in collaboration with Google Health, Intellisoft Consulting, and Health IT, has organized a series of events that includes webinars, boot camps, and hackathons aimed at introducing participants to the essential concepts and tools necessary for building cutting-edge digital health applications. So even when you can see from the poster, we have a series of webinars. For this month of June, we have 4 sessions or 4 webinars, all with different topical areas. We kick off today's session on the topic of setting the context, why open standards and architectures matter. And the objectives of the webinar sessions is to introduce health information standards, open health stack, the World Health Organization smart guidelines, and solutions built using open health stack. Then thereafter, we'll be having boot camps, and this will be in person, and this will be done at Kabarak University. I can see here the objective is to develop hands-on skills on building the Android FHIR SDK. Then going down here, after that, we will be having another in-person session, hackathon, and the aim or the objective will be to develop digital health solution prototypes based on open health stack. So we have very eventful sessions coming up for all of us to learn. And to kick us off today, I would like to welcome Dr. Job Nyangena, the head of Division of Health Informatics at the Ministry of Health, to make his official remarks on behalf of the Ministry of Health and to officially open the webinar series that is starting today. Karibu, Daktari.
Thanks a lot, Laura, and the entire team at the Center for Health Informatics at Kabarak University. My name is Dr. Job Nyangena Nemeno. I'm the division head for the Division of Health Informatics at the Directorate of Digital Health Informatics Policy and Research at the Ministry of Health. And I'm happy to be here today. So I'm really excited by this webinar series because it's smack in the middle of government efforts to facilitate health information exchange as a broad vision that we have. So the government is currently in the process of setting up or establishing or digitizing its operations. Of course, there's the whole government approach where the government is seeking to modernize its operations through digitization. But specifically in healthcare, we're looking to digitize our operations. And what that means is, can we facilitate seamless information exchange across different health information systems in the country? And to do this, we need an interoperable ecosystem. So in recent years, interoperability has come to be sort of through smart guidelines, FHIR, and the open health stack. As the through different eras, we have different technologies that help facilitate interoperability. And currently, the Fast Health Interoperable Resources, that's FHIR, has become the cornerstone of interoperability. And lately, we've had Google with the Open Health Stack and the WHO with the smart guidelines, which are based on FHIR, as supporting this interoperability. Currently, we have, as a government, we are focusing on UHC, and UHC is going to be focused on primary care. And the ministry is particularly interested to ensure significant improvement in the quality of care based on standard of care, hence the importance of smart guidelines, where they're going to facilitate decision support in all the systems that we're going to implement. And this will all be enabled by a standards-based digital health ecosystem. The government, through the Ministry of Health, recognizes that the quality of digital health solutions is directly affected by the choice of the tools we use. And therefore, the tools that I've mentioned, the Fast Health Interoperable Resources, that's FHIR, the Google Health, Open Health Stack, and the smart guidelines by WHO, are in line with ministry objectives to ensure that the digital health solutions that are going to be implemented are technologically sound, sustainable, intuitive, and friendly to use by all providers in the country, and that they're going to help us contribute to delivery of quality, affordable, and efficient healthcare services. So one of the things that I said is exciting me about this webinar series is we need more people sensitized on this, these technologies, to be sensitized on the need for an interoperable health information system. And, building human capacity is critical. And I really want to thank the Center for Health Informatics at Kabarak University for setting up this series of webinars. I also understand there'll be boot camps and hackathons being run by this institution. And these are going to help greatly help to contribute to increasing the human resource capacity, in increasing the skills needed in digital health and health informatics in the country. And finally, it's really, I see we have quite a few, or rather many attendants of this webinar. And really it's to make a call to all of you, practitioners of digital health or future practitioners of digital health, to embrace these new technologies, the smart guidelines, the Fast Health Interoperable Resources, the Google Open Health Stack, and really any emerging technology that is going to enhance the building of an interoperable digital health information system in the country, that's going to help build the next generation solutions that will support the Ministry of Health, the government, and really the entire country in delivering better care to Kenyans. And so this is also a call to that we take advantage of this period where the government, is very focused on digital health, and where we have stakeholders like Kabarak University and their Center for Health Informatics really taking a front seat in delivering this. And we hope, we get to a point where we don't really need to push anyone to adopt these standards, but where people embrace them, and we have a cordial digital health ecosystem that has interoperable information systems. And with that, I'd like to, hand it back to the session chair, and thank you all, and wish you all a great webinar and even the series going forward. Thanks a lot.
Thank you so much, Daktari. Thank you for your opening remarks. I now welcome Mr. Steve Onyi from Intellisoft to take us through this the session. And to all our attendees, in case you have any questions, kindly use the Q&A section to put in your questions as we go through the session. Karibu, Mr. Steve Onyi.
Thank you very much, Laura. Please confirm you can hear me.
Yes, I can hear you clearly. And also kindly, I can see we have other guests as well. Mr. Steve, kindly, if you can introduce them as well to the panel, to the members. Thank you.
Okay, sure. All right. So let me see if I can get there. Stop sharing first. Yeah, no, so I think, thanks a lot, Dr. Laura. So today we are joined by Fred Hash from Google Health, Nicodemus Kimondo, and Peter Nziano as well. I believe you're from all of you are from Google Health as well. Welcome very much to today's session. Thank you for making time to be with us today. So given that we only have, I believe, until 5 o'clock, let me go ahead and share my screen. And we can get started. So, so as Laura has mentioned, today's the first series of this webinars, and this first session is focusing on just basics of digital health, and more specifically, we're going to discuss or at least share a little bit about open standards and architectures and why those matter with regards to what we're all trying to achieve here. So as Dr. Job has mentioned from the Ministry of Health, MOH is very clear about what they want to achieve with regards to improving healthcare in Kenya, making it affordable, improving its quality, and ensuring that it's accessible to every Kenyan. And so for that reason, digital health has been identified as one of the tools, one of the methods, one of the approaches that the government is keen to use to achieve the universal health coverage as defined in Kenya, starting with the primary healthcare services. So today's webinar series is really just setting the context and basically ground truthing as much as possible so that we can all start from the same page. Subsequent webinars are going to build up onto this. So this session is critically important, and we're not making any assumptions in terms of even terminology. We just want to make sure that we understand each other and we have the same definitions of the language we're going to be using going forward. So as Dr. Laura has mentioned, we've got a couple of really exciting webinars ahead. They're going to start getting a little bit more technical as we go week by week, and as we get closer to the bootcamp and the hackathons after that. So in today's, just want to skip that, you saw that already. So in today's session, it's probably going to be the next like 30 minutes. Hopefully you'll have some few minutes for questions and answers. Want to go through basics of digital health. We'll get into discussions around architecture, standards, and content in relation to what we're trying to achieve here, which is basically to build the next generation digital health solutions using the best technology available, best approaches, best science, and the best capacity we can get. And thirdly, we'll touch on building next generation health solutions, and specifically we'll be looking at the Google Open Health Stack. So just in terms of basics, again, assuming that we all coming into this fresh, what is digital health? It's really a combination of two English words, digital and health. Digital, again, pretty straightforward. It's a series of signals that are expressed as zeros and ones, and health, as you know from WHO definition, it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that's the same definition that the government of Kenya uses as well, with regards to a health policy and the laws around health in Kenya. So then what is digital health? Again, building up from that very basic definition, it's a systematic application of information communication technologies, computer science, data, and data to support informed decision-making by individuals, policymakers, health workforce, the health system, to strengthen resilience of the health sector, to fight against disease and improve health and wellness. So, so just 1 second. So basically, what does digital health encompass? So it encompasses all concepts, activities that are at the intersection of information, communication, and technologies. And in a nutshell, that's what it looks like. If you're looking at this visually, you'd have digital health at the middle, drawing from all these activities that are happening in ICT, basically. So you have the technologies on the left topmost, the hardware, the devices, and all that. Then you've got all manner of data used through analytics, visualization, either on your personal end user devices, or it could be on some big screen somewhere if you're a county both, national both. And then you've got all these applications at the bottom. So if you're working in digital health, all these terms are familiar to you. These are deployed on mobile devices. You've got electronic logistics management information systems. Telemedicine is becoming really big, where distance is a factor. and you're providing healthcare services, health information systems and lab information systems. And this list can grow quite big. So evidence has shown that digital health confers certain benefits. And these include driving demand and improving access to care, increasing accountability, and enhancing quality and improving efficiency, ensuring protection from health costs, and improving supply of services. So what we're talking about here is not fancy things that are nice to have, they're exciting and all, but there's actually quite a lot of science that supports the fact that digital health interventions are useful with regards to improving healthcare. And this is just some evidence of what's been shown through trials. We probably are all familiar with the term universal health coverage and sustainable development goals. And so when you're linking the benefits of digital health interventions or solutions or systems, whichever term you're comfortable using, then you have to link them to a certain claim. The claim here is that if we do things right with regards to digital health, we'll contribute towards achievement of universal health coverage, which basically is defined as a situation or scenario where everyone, irrespective of socioeconomic status, will have access to quality health services that they need without incurring financial hardship. So again, as Dr. Job mentioned, in Kenya, UHC is critical. It's been prioritized by the government, and the Ministry of Health is strengthening achievement of universal health coverage through primary healthcare services that is building strengthening the health system from the community going all the way up to the national level. And so, thinking about that, then universal health coverage and SDGs, we're probably, some of you might be familiar with SDG 3 around good health and well-being. That closely links to, it's achieved through universal health coverage that is achieved through responsible use and effective use of digital health solutions. So a caveat there that while not a silver bullet, investing in digital health will help to accelerate the process for these two goals to be achieved more quickly. We actually achieve universal health coverage and SDG 3 of good health and well-being. And again, these are not goals that are very far from us in Kenya. So if you follow very closely what's going on in the health sector, you know that UHC is part of the current administration's agenda in the health sector. So a couple of other simple definitions. Again, I realize that these are pretty trivial, but I think it's important for us to be on the same page. Software, we know what software is, applications rather. This is applications that does things. What's an enterprise? An enterprise is lots of applications, software applications working together to do a big thing. And then what is interoperability? It's the way these applications communicate on the enterprise. And lastly, what is an architecture? It describes how software fits together to create an enterprise. These terms are really important, so please take note of how we're using these terms because they'll keep featuring in this webinar and subsequent webinars. For the simple fact that one of the things we're trying to address here is use of standards, ensuring that we are building solutions based on guidelines, clinical guidelines that have been transformed into computable guidelines, so-called smart guidelines, and we'll get through what that is. And we're also looking at this from an architectural perspective, as Dr. Joe mentioned, trying to avoid fragmenting the health system, as has been the case for many years. Another term that is going to keep featuring is global goods. And global goods are open source digital health applications that are designed to mitigate some of the generic disadvantages or weaknesses of open source software. So global goods are free and open source software that are adaptable to different countries and contexts. They're supported by strong communities of practice. They're funded by multiple sources, especially in the public health sector. They're deployed at a significant scale, and they're designed to be interoperable across commonly used systems. So if you're working in public health in Kenya, you've encountered global goods. Examples are DHIS2, which in Kenya, it's called the Kenya Health Information System, that is housed at the Ministry of Health, Afya House in Nairobi. You probably also come across OpenMRS, you've come across OpenSRP. So all those are classified as global goods because they're characterized as displayed here on the slide. So again, this is an important term because a lot of what we are talking about today and in subsequent webinars will be within the purview of global goods because it's a responsible, good way of doing things and doing digital health, particularly in public health, but also in private health as well. So the second part of this, or rather the first part of this webinar series, now that we have a couple of basic definitions and concepts out of the way, is architecture and enterprise architecture specifically, and why that approach is important. Again, like I mentioned before, the health sector, like other sectors, works as an enterprise. And from what has been done over many years by international bodies such as WHO, International Telecommunications Union, and many other organizations, they have defined certain aspects of what's required for digital health to work in any country, in any context. So they're looking at this as a county, whichever county you come from, or you're looking at this as a national level in Kenya. These things are critical for digital health to work. You need very strong leadership and governance, and hence the reason why we also have Ministry of Health with us today here. Ministry of Health, as you know, is responsible for healthcare in Kenya. And this is the constitutional obligation that they hold. They're the custodians of healthcare in Kenya. If anything goes wrong in Kenya in terms of healthcare, they're responsible. They're the ones who provide guidance on response to diseases. As an example, you saw what happened during COVID. The ministry was always providing guidance about this is what's going on, how many cases, what are we doing, what should you do and not do, and things like that. And ministry also publishes guidelines for how healthcare should be provided in Kenya. These guidelines come from WHO because Kenya is a member of WHO. The other building block that is critically important is strategy and investment. As Dr. Job mentioned, government works with strategies. We know we've got Vision 2030 in Kenya and many other sort of strategic documents. Ministry of Health also have strategic documents, even for digital health as well. So these are important to ensure that we have direction. We have a North Star, we have something we're working towards, and we can measure that over time. The third building block is services and applications, which is what we'll be focusing on a lot in today's webinar and subsequent webinars, including in the hackathon and the bootcamp. We'll also be talking quite a lot about standards and interoperability. What are standards in healthcare and specifically in digital health, and why are they important? Again, what is interoperability? We just went through the simple definition of interoperability. This time will come up a lot of times, and we'll also contrast interoperability with integration. Infrastructure, critically important. Data doesn't just move around without investment in infrastructure. For those of you who are in hardware and networking and all, you know, that's really your world. You know, you lay out cables, you lay out fiber, different technologies and methods of transporting data packets. We need to all agree how to do things, and that falls under the building block called legislation, policy, and compliance. There's all manner of laws starting from the Constitution of Kenya 2010. And out of that, different sectors have developed different policies, different standards and guidelines, different strategies, but all of those are expected to be lawful. And so this building block is important because we have to agree how to do things. You have to agree, for example, what data do we share? What data don't we share? How data is protected? What can you do? What can't you do? In this era of artificial intelligence, we all know how dangerous that can get, much as it's exciting. So at some point, you need to agree that this is unethical, this is criminal, and this is okay to do. And then lastly, the seventh building block is workforce. Without people who are skilled, knowledgeable, and competent, then all these will amount to naught. So for most of this webinar, we'll be focusing on let me just go to the next slide. We'll be focusing on these three building blocks: services and applications, standard interoperability and infrastructure. And these are termed as the ICT building blocks of the enabling environment, which consists of the 7 building blocks. So again, this is a very important slide, just so that you understand that the way to resolve fragmentation and ensure that we are building the digital health enterprise and ecosystem as a whole is to embrace this framework and ensure that each of these building blocks is receiving adequate investments and attention. So out of that, then we have to talk about enterprise architecture. So again, for you architects in the meeting, this is standard practice, especially if you're involved in putting up facilities, physical facilities and infrastructure. This is pretty straightforward, but I think in software, this tends to be a little bit abstract, but basically the definition is the same. You know, enterprise architecture is a blueprint that defines business processes, data, systems, and technologies that are used to help developers, implementers to design complex systems. Data systems are complex, electronic data systems are even more complex. Health sector is extremely complex and a very controlled field that has a lot of very procedural instructions on how to do things, because a mistake in healthcare means you can kill somebody. So there are aspects of healthcare that you don't get a second chance. It's for that reason, healthcare is very complex, and so building software for the health sector to take care of human beings is an extremely complex issue. And therefore, the reason why these webinars are really focusing on smart guidelines, FHIR, and open health stack is because of how critical it is what we're building. It's not just tools for collecting data, running, monitoring, and evaluation reports and statistics, but it's really because digital health now it's a mode of service delivery. So the way doctors use stethoscopes and all, digital health has gotten to a point where it's such a critical tool for clinicians, for healthcare workers to use to take care of their patients and clients. So just visually, that's how an enterprise architecture looks like. Typical enterprise architecture has those 4 components: business architecture, data architecture, application architecture, and technology architecture. We'll focus a little bit more on the application architecture, which is what you're seeing in the middle, looking at that hierarchically and how it creates interdependence and how that will affect how we build digital health solutions. And that's just a pull out of that layer, where we'll see one of the most popular frameworks globally is called the Open Health Information Exchange, that basically has three layers or sections, if you can use that term for now, with the top one being component layer, which are common services, and we'll get into the details of that, an interoperability layer, and the point of service applications. So a lot of what we're doing will be at the bottom layer, point of service applications, and how we build those in a way that make them interoperable and in a way that they can actually consume the services that you're seeing above here in the component layer. And we'll get into all these small little diagrams and the letters mean in a few slides coming up. So just to illustrate the complexity of, just give me 1 second, this thing is in my way. Just to illustrate the complexity of interoperability, the easy way to do interoperability is to connect to systems directly, so-called peer-to-peer models. But just see how in a very short while, if let's say you've got 2 systems, you've got open logistics management information system and you have DHIS2, and these are the 3 things you want to share. You want to share supply list, you want to share facility list, and you want to share stock levels between just 2 systems. And you've decided that the best way for you to, you don't bother with standard, you don't bother with any of best practice of how to exchange data, and you're just going to connect them, hard code them. We do that all the time because it's easier. Over time, though, this is the complexity that you're building up. So those are the 3 things you're trying to share between those 2 systems. But when you start adding additional systems and you're sharing the 3 things, you can see how complex in a very, very short while this thing becomes. Now, it's easy if you're doing this for a small setup in one health facility in your village or in your town. But if you're doing this at your county level, or you're doing this within a sub-county, and even once if you're doing this at a country level, this is what you end up building. And this is the situation in many countries, including Kenya, unfortunately. We've got a lot of these sort of connections that are peer-to-peer, people trying to force exchange of data because that's how the business is run. Healthcare needs to exchange data. Doctors need to understand what supplies are available. You've got the healthcare worker at the facility who's running some electronic medical record system on a tablet, and they want to know their stock level before they write out a prescription or before they dispense. You've got the guy at Kenya Medical Stores Agency, KEMSA, wondering what's the demand level from my consumers across the country. You've got the lab figuring out, do we have enough gloves? Do we have enough tubes and all that to run certain tests? So in a short while, a very small task like this of exchanging just 3 indicators or 3 pieces of data in order to share supply list, facility list, and stock levels can become very complex in the absence of standards. So what you're trying to say here, and what we're trying to argue for, is a standards-based health information exchange, which some people also call the digital health platform, where you've got a health information exchange in the middle, and you've got all these participating spokes, that are exchanging data, but through one common layer. And again, we'll touch on that a little bit. So for those of you who are interested in data and evidence, peer-to-peer models have been shown to lead to quadratic increases in number of needed connections. So if you follow this slide from the top, if you've got two systems, you only have one bidirectional connection. Fairly simple, straightforward. You add one more system, then you've got 3 bidirectional connections. You add another system and you have 4 systems, then shortly you have 6 bidirectional connections. All of these have to be maintained. So the costs of maintaining systems that are peer-to-peer connected quadratically increases as you keep increasing the connections. So again, this is from studies that have been done, proving the point that you really need to embrace standards right from the word go, to even just manage your cost for developing systems and implementing systems. And I'll try and get the reference for this paper, but they've shown that the increase in terms of cost implications, it's quadratic. So the more you add connections, the cost actually increase quadratically. So there's true Kenya shillings or dollars that you're going to spend by not doing things the right way from the onset. So the cost savings in terms of adapting a health information exchange are huge, and those come from us embracing the sort of the diagram that I showed earlier, where we're looking at health sector as an enterprise. We're looking at all the 7 building blocks, and we're embracing a health information exchange approach to connecting system and exchanging data. But that also means that the underlying systems, the point of care systems, also have to be built based on standards so they can plug into the health information exchange. And that would be a big focus of this series of webinars, the bootcamp and the hackathon. So this is an example of a digital health enterprise, that basically shows how interoperability is facilitated. So the way to read this would be, you can look at this from the bottom, where you've got the point of service systems, or we can even start at the top, where you've got all these systems that store information. These are the little things you're seeing in the previous diagram. These things here are the common services. Some people call them common services or shared services that are required, that not every system requires to invest in them. They need to be done only once. They are infrastructural components that are managed by the government, by Ministry of Health, and they are shared services. So which means that if you're building a system on the bottom here, let's say you're building an mHealth system, you don't need to come and build a client registry and put it in your system. You don't need to come and build a technology service and put that in your system. That you need to build your system in a way that can call on, can basically connect to any of these common services and get what you want. An example is, if you're building a system and need to identify people uniquely, then you don't need to build the unique identification capabilities in your system. Your system needs to consume something that uniquely identifies Kenyans or people who are coming to seek services. Now that thing or that service is maintained by government, and in this diagram here is referred to as the client registry. If you're trying to figure out the names of facilities, so that when you're transferring a patient from Kenyatta to Mbagathi or to Jaramogi Odinga or to Coast General Hospital, you'd want to know what's the name of that facility. Does it have a unique code? That information will be found in the facility registry where care is being provided. The third thing is you also want to be sure that the patients are being cared for by healthcare workers and clinicians who are actually qualified. So there are a lot of agencies in Kenya, organizations that are responsible for that. And that information is found in the health worker registry, so that everyone who's formally trained, certified, and they're allowed to practice in Kenya, their records would be here. So if you're building a system, then you want to assure your patients or whoever is in the system that whoever is taking care of them is qualified, certified, and allowed to practice in Kenya. So that information will be found here. Similarly, if you're in the business of supply chain and you're moving things from a warehouse, distributing them, medical products and supplies, then that information will be found in your product catalog that uniquely identifies every product that gets distributed for purposes of delivering healthcare in the country. So this diagram here is borrowed from a framework called Open Health Information Exchange, OpenHIE. If you're interested, please visit openhie.org. It's a community of practice, most importantly, that brings together people who are trying to solve this problem of interoperability, looking at standards, frameworks, patterns, basically how to exchange data meaningfully, responsibly, lawfully, and ethically in any health sector. And the next component that is important to understand from this diagram is the interoperability layer. So this is just a piece of software that orchestrates how data moves from the point of service systems, references whatever it needs to reference here, and data moves to each destination. So the most, one of the interoperability layers that is quite popular is called Open Health Information Mediator. Again, if you visit the OpenHIE website, you'll find more information about that. Again, throughout this webinar series and the bootcamp and hackathon, we'll get into the technical details of this for those who want to play around with it. And lastly, you've got the point of service systems where data is collected and information is used by different people. And then this is obviously a cyclical process, hence why you have those two arrows going around. So just to recap, what is interoperability? It's the ability of multiple systems, applications, and devices to communicate with one another. And they do this by accessing, exchanging, and making use of data in a standardized and systematic way to achieve goals. Please take note of the word standardized, because that's what we're going to be talking about next. What are standards? And I know most of us use these two terms interchangeably, but they mean different things. Integration and interoperability are two different terms. What is integration? Is when two applications directly exchange information. You saw an example, and this often involves one or two systems needing to be exchanged, needing to be changed to exchange the information. So there's a bit of intrusion in integration, as contrasted with interoperability, where multiple applications can exchange information without changing the actual application. So I don't need to know what you're doing, how you store stuff, things like that. But we just need to agree on how to exchange data, what language you're using. So that's all in the realm of APIs and all that. And that's a big, big focus of this webinar series that we're starting off with today. So standards, like I've shown before, they make interoperability easier and more cost efficient. They, by definition, obviously, a set of rules that we all have to abide by as we are building software. Now, standards are complicated, and that's why people don't like them, and especially they're more complicated if you have to build software that complies with standards. And so one of the reasons for having this series of webinars again, and in the next one, probably the next couple of webinars, we'll hear from Google Health about Open Health Stack, which is one of the ways that they're trying to make it easy to build applications by taking away all the pain of developing the building blocks and the tooling necessary, so that software developers don't have to worry about keep reinventing the wheel and building things that don't really help you move things forward and solve actual problems, because they're so fundamental. So that's a big part of what Open Health Stack is. And at the next webinar, we'll hear more about what that is. So the couple of different types of standards. The general technology standards that we're probably quite familiar with, and these are non-health specific. They're really just in the IT industry. HTTPS, PKI, JSON, XML, and all that. Healthcare has its own set of standards that are fairly popular and used quite a lot. Some of those include the International Classification of Diseases, version 10, now there's version 11, CPT, ISCO, and many others. And then you also have other standards like what was mentioned earlier. There is the HL7, the Standards Development Organization. You've got organizations such as the IHE, you've got standards like DICOM, CDA, and all that. And our main focus will be the first healthcare interoperability resources, FHIR, which is really what the world has come around and embraced as the way to build digital health solutions in a way that helps to embrace standards responsibly. So basically, standard health system protocols or processes which are common in many countries, including Kenya, FHIR is, I would say, top on the list. As Dr. Job mentioned earlier, MOH has formally embraced FHIR, formally embraced SMART guidelines. And so we'll be focusing on those two specifically quite a lot as we go through this series of webinars. The two types of standards in terms of classification are semantic standards and syntactic standards. So semantic is really the vocabulary in terms of what you say, the actual terms. And again, like I mentioned, those include the well-known ICD-10, SNOMED, and others. And then syntactic, which is a grammar, which basically means how you say it. It's really a set of rules and the relationship between vocabulary terms. And the well-known ones there is FIRE, and there's a bunch of others like DICOM for digital imaging and communications. IHE is a very popular body that works quite closely with HL7 that develops FIRE to integrate the healthcare enterprise. There are a couple of examples here that I think I might go through pretty quickly. And they were trying, the attempt was to try and show, data exchange between two systems. In this case, we're going to keep using OpenLMIS and DHIS2. So OpenLMIS, for those of you who are in supply chain, you know that it collects detailed information on products such as vaccines or commodities, and where you want to report vaccine. And this slide is trying to show an example of how that would happen between communication between OpenLMIS and DHIS2. And DHIS2, we know, is an aggregate level system that collects information in an aggregate manner. It has DHIS2 mobile and all that can collect individual level data, but is mostly known for aggregate level data. So in this example here, DHIS2 would like to know about vaccine stockouts, and let's see how that sort of communication would happen. So OpenLMIS would tell, or rather would tell DHIS2 that I've got 5 DPT vaccines in BioClinic this month. And DHIS2 would say, would understand what that means. They would say, what are you trying to say? What do you mean? Jane BioClinic, what's a DPT vaccine and all? Because computers don't understand natural language like that. So basically, DHIS2 would need to be told that BioClinic and J.BioClinic are the same. They're referring to the same facility. And OpenLMIS, in this case, we need to tell DHIS2 about the vaccine commodities that it manages. And then the two systems would need a common language, grammar and vocabulary talk with each other. So again, as a very, very simple example of trying to transmit a fairly simple communication between two systems built by two different organizations, maybe built using different technologies and all, this becomes extremely difficult, yet you need these two systems to operate and exchange data. Now, where you've got standards being used by these two systems, then DHIS2 and OpenLMIS would agree on a certain vocabulary where they're able to identify the list of vaccines that OpenLMIS is keeping. And in this case, let's say OpenLMIS would use a registry like the product catalog that is very clear. These are the names of the vaccines. They're all standardized. They are uniquely identifiable. And so when OpenLMIS sends that information to DHIS2, because they're using the same product catalog, then DHIS2 would understand what OpenLMIS is saying. So again, just asking a couple of questions, DPT vaccine 1 up to 3, as an answer to the question that DHIS2 has asked, what is your list of vaccine commodities? And that's how that conversation would go. There's a standard called MADX that would be used to facilitate this kind of conversation between these two systems. So again, this just goes to the point that if you've got developers who are building DHIS2, others who are building OpenLMIS, and the health workflow or the business requires exchange of this information because the guys who are managing the warehouse where the vaccines are stored and using a system called OpenLMIS are not the same people who are asking the questions about what's required in the field, who are probably public health experts, and they're using another system called DHIS2. So at a software level, you need to have a way to ensure that the two systems, which are not subject to human interpretation, actually understand each other. So in this case, the value we'll be reporting is DPT vaccine, and the place data is coming from is facility number 24. So if you look on the left-hand side, we're at this point, we're not dealing with Jane Bayer and funny names of vaccines because these are then codified in the dictionary that is shared by these two systems, and there's a reporting month. So it's very clear what period we are talking about. And then in that case, these two systems can share data effectively. So again, this might be a little bit cryptic, being maybe some of you are seeing this for the first time, but the idea here for this example is to show that you really need to express very clearly what you want systems to do, and standards are the way to do that. Standards exist. We don't need to reinvent them or recreate them. We need to know what they are, but we also need to know how to use them. And we'll be learning a lot of that over the next couple of series. The next section, just being wary of time here so that we don't keep people too long, is content. Why is content important? I don't know how many people have heard of SMART guidelines, but SMART guidelines is it's a publication from World Health Organization. It's an acronym that stands for standards-based, machine-readable, adaptable, requirements-based, testable guidelines. And basically, it's a series of 5 knowledge layers, where the thinking here is, or rather, where this is coming from is from how healthcare and medicine is practiced. You know, so healthcare is provided based on evidence that comes out of clinical trials. You know, these are conducted globally. In Kenya, we know we've got the Kenya Medical Research Institute and all the universities that conduct research all the time, generate evidence, research evidence, and then that evidence has to be converted into policy for practice purposes. So WHO works with all its member states, including Kenya, to collect the best evidence for how to take care of certain diseases. So for instance, COVID came out, and everyone had their own little ways of managing COVID based on what they thought, how they thought COVID was transmitted, where it came from, and the effects of COVID and all that. And we saw a lot of, and for that reason, we saw a lot of people managing COVID differently. I'm sure most of us are frustrated with all the sometimes conflicting guidance about what to do or not to do. Don't touch your face, don't do this, things like that. But we are all looking back to ministry to give us guidance, and ministry published guidelines for how to take care of COVID. If you're a pregnant woman, if you're a young person, if you're an older person, the things you need to know about, if you've got underlying diseases, you're more susceptible to catching COVID and with more severe outcomes and things like that. So all that stuff belongs in L1, layer 1. And these are narrative guidelines, they're living guidelines that come out of that process. And they're published by WHO. Countries like Kenya take them on and they domesticate them and publish them. So healthcare in Kenya, what is termed as standard care, is informed by clinical guidelines or health service delivery guidelines. Now, the thing is that these are usually booklets, like you can see here in the picture. Now, for software developers who are building software, when you're trying to figure out what's the logic for something, so for instance, if you're building an app for COVID, for to be used for COVID care, you probably have to talk to a doctor who understands what this thing is, how it's managed and all that. But at some point, as you're figuring out the requirements and deriving specifications, you probably have to go and study the guidelines. Or maybe you have a business analyst who can translate to you, this is the standard care. And for you as a developer, these are the specifications I've written for you. And then so build your software with this logic so that it does the right things based on the interaction with the users or the data that it collects. So I think we all then, from just that simple description, understand that it's very difficult for software developers and people building technology to always translate what's in the narratives correctly. And then secondly, most of it is written in a fairly sophisticated medical language that most techies don't understand. So if you don't have somebody who's a clinician or coming from the health sector, you probably misinterpret what you're reading here, and you end up building software that will not do what it's supposed to do. It doesn't follow the clinical guidelines. So what this SMART approach has tried to do is, one, acknowledge that this exists, that these documents exist because of how things are done in healthcare. But then now, out of this, break out the content that is here into what is called the digital adaptation kits. And this is where you're starting now to really focus on going digital. So what has happened in the L2 is the content that is here in L1 out of this booklet has been chunked out into, I think there are about 8 components now, and they are human readable components, operational components. They also include structured workflows, decision support documentation, data dictionaries, and they specify users through personas and all that. So you're basically taking all that is here and you're making it simpler for developers of the digital health solutions to understand. Because then now here you've got the logic very clearly written for you to know this is what you do when you get to this point. You've got the business workflows that are clearly outlined. You've got the personas, who's going to be using the system you're building and all that. But again, that's not, that's better than L1, but it can get better. So then what L3 has done is out of these components, it's tried to make them machine readable. So here you've got a fire implementation guide that is based on the clinical practice guidelines coming out of L1. But then out of here, you're basically building libraries that has standard terminologies, value sets, calculations for decision supports, and anything else you need that is actually understandable by software application. And then L4 is the actual software application itself. So in the next webinar and the set of webinars, we'll see what work has been done in terms of using smart guidelines. First off the block has been for ANC, and that's part of the work that Kabarak led in conjunction with Google Health, ourselves, Intellisoft, Health IT, and others to build an application called Mama's Hub. So that has been built based on this approach of smart guidelines, and that's what will feature a lot in the bootcamp. So we really encourage everyone who can make it for the bootcamp to come and see how this cool stuff works. And then L5, I don't think much has happened here, but this is where the hope is once we build all these things properly, we'll get to a place where we can run all these advanced analytics, AI, do all this really cool, more exciting stuff a lot more easily because you've built all the basic components. All right, I know you've got 5 minutes. Apologies, this is pretty long. But I think this is probably my last slide. Just to wrap up and say that for those of you who are seeing this for the first time, I know this sounds really cryptic, probably very confusing. But the idea was that, just to emphasize that the purpose for this first webinar was to introduce you to digital health, basics of digital health, the importance of standards, the importance of architecture, the importance of smart guidelines in terms of what they are. And then lastly, and most importantly, just to highlight the importance of open health tech, which we'll talk about a lot more. So this is a Google initiative of building the next generation health solutions. Please visit their website, just Google Open Health Tech and you will land there. But this is the way that Google is equipping, especially engineers and all those who are involved in building digital health solutions to build the next generation health solutions that incorporate all those things that are spoken about. Probably not very articulately, but the idea is that as an engineer, you'll have tools at your hands that will help you build solutions faster, but knowing that you're building them based on standards because all those are already baked into the tools you're using. An example of that is the Android Fire SDK. So again, please explore Android Fire SDK and you'll see what I'm talking about if you're a developer. To also ensure privacy, we know that now we're getting into an era where everyone is very worried about privacy and protection of their data. And it will also unlock really great insights in terms of using very, very powerful analytics that are based on powerful technologies like Fire data stores. So in conclusion, what I'm saying in short is that I'd like to leave this slide as the take-home message for you. Please think and reflect a lot about smart guidelines, reflect about standards,